Another way the industry sways the FDA, many of the physicians, caregivers, and other witnesses before the FDA advisory panel that evaluate drugs receive consulting fees, other compensation, expense payments from the pharma companies. Former FDA employees report, the more that the FDA relied on industry fees to pay for drug reviews, the more it showed an inclination toward approval. Dr. Marciniak, a former FDA medical team leader, stated, "You don't survive as a senior official at the FDA unless you are pro-industry. The FDA has to pay attention to what Congress tells them to do, or the industry will lobby to get somebody else in there if they don't like you." 78% of novel drugs approved between 2014 and 2016 qualified for one or more accelerated pathways. Further, the breakthrough therapy was doled out to 28%. Nuplazid was one of them. It was created in 2001 by Acadia Pharmaceuticals. 8 years later, in the first of 2 phase 3 trials, it failed to prove its benefit over a placebo. The company, which had no approved drugs and no other form of revenue, stopped the second trial. Acadia executives told investors that the trials failed because the placebo patients had a larger than expected improvement. The placebo patients. So Acadia would later revise their benefit measurement tool. This tool had never been used in a study for drug approval. Moreover, Acadia requested the coveted breakthrough therapy designation, and this was granted. Thus, only one positive phase 3 trial was needed for their approval. After many attempts, Acadia finally got their results. They did this with a sample size of 199 patients. Nuplazid showed a small but statistically significant advantage over a placebo. Later, FDA medical reviewer Dr. Paul Andreessen analyzed all of Nuplazid's trial data. He found that 91 patients would need to be treated for 7 to receive the full benefit. 5 of the 91 would suffer serious adverse events, including 1 death. He was against its approval, citing an unacceptably increased drug-related safety risk of mortality and serious morbidity. These people be crazy. It's getting dark out here too. Okay, take care. Bye-bye.